If I didn't have Henderson, I might be dead on the street.
Why?
Because I was homeless. I'm a homeless veteran with nowhere to go. Here I have food. I get help with my addiction problems, mental health problems. You know, I got 3 hots in a cot and surrounded by good people, the staff and patients alike. It's a good treatment environment, and I've been in many. I'm 57 years old, so I can testify to that. It's a great place, and they actually did save my life.
This is just one of thousands of testimonials from Henderson's Crisis Stabilization Unit, or CSU. A mental health crisis can occur any hour of any day to anyone. Although mental health conditions are common, sometimes they become so overwhelming that it requires emergency acute care, intervention, treatment, and stabilization. When it does, Henderson Behavioral Health is here to help.
If Henderson wasn't there with the services that we've received, I would be very fearful that my son would be viewed criminally instead of mentally, and my concern as a parent that he would end up in jail.
Henderson is one of the oldest and largest behavioral health systems in Florida, and we have the only community-based CSU in Broward.
If I didn't have Henderson, I would be dead today.
Our CSU provides immediate, short-term, intensive treatment and stabilization for individuals having a mental health crisis, 24 hours a day, 7 days a week, regardless of their ability to pay. Patients have access to a highly trained CSU support team, doctors and therapists who work with them to provide treatment for stabilization, crisis de-escalation, and early intervention. Services can include anything from psychiatric evaluations, medication management, counseling, to aftercare services. Early intervention is so important in a time of need. It can prevent hospitalization and/or incarceration and stabilize acute situations.
A crisis stabilization unit is a place that Broward County needs. It's a place for people to go when they have a mental health emergency. It's the first line of care to get somebody started, connected, and integrated into ongoing treatment.
Nobody else in the community provides the kind of services that Henderson does, and does it for people that can't even afford to do it for themselves. So we feel the necessity to get out and help with that infrastructure.
The need for crisis stabilization is getting greater. Henderson is getting stronger, but our facility is getting older. This building is 60 years old, and it wasn't designed with healthcare in mind. As the need for crisis care continues to grow, the inadequacies become very evident. From the small things of not having a key swipe for the doors, or big things like not having a family waiting area. Our current location is also inaccessible to public transportation.
The current crisis stabilization unit, while it provides excellent care, is not representative of what we want to provide to our patients and families. The design, materials, and technology are really obsolete and not up to the current standards that we want to provide for our patients and families.
The Leo Goodwin Foundation is very interested in addressing mental health issues in our community head on. And one thing that is required is a good CSU, Crisis Stabilization Unit, and Henderson Behavioral Health is in the process of starting a campaign to build a new unit that can adequately address the needs of people who are in that situation and need stabilization.
Our $5 million Growing Strong campaign will fund the relocation of Henderson's existing CSU to a new state-of-the-art facility that is designed with healthcare in mind, doubles its size, and can offer an evidence-based therapeutic environment that is much more easily accessible to the community. The plan is to build the new CSU on the existing property that Henderson owns, located in central Fort Lauderdale. Ideally located just minutes from I-95 and the Turnpike. It's a safer neighborhood than the existing facility, and it will be accessible to all modes of public transportation.
The Crisis Stabilization Unit, which we are funding at this time, will provide the much needed services for adults and children. Mental health is just being recognized among the community as a whole. And Henderson Behavioral Health is the organization that can deal with those issues.
Care begins when someone comes through our door. We want that initial step to feel welcoming and safe. On the inside, the new CSU will provide a safe, structured therapeutic environment. Unlike our current CSU, we will be duly certified to serve both adults and children with mental illness and/or addictions. Our capacity will also increase from 23 to 48 beds. Family areas will be added, as well as an expanded outdoor space.
This community needs a facility, nobody else is going to do it, and Henderson has the capability of doing it and doing it well.
This is our community. We are all responsible to care for those in need. I invite you to grow strong with Henderson.
We are all growing stronger with Henderson.
Without your support of this important project, many who are in crisis would go without critical services offered by Henderson. So thank you very much for your help.
I'm excited that this will be happening because I feel like as a community and definitely as my family, we're growing stronger and we've got opportunities for our children and our families to be the best that they can be.
We thank you for your help and support, and now let's get to work.